Good evening and welcome to our second phase of community engagement session. My name is Roseanne Bailey and our second co-host is Megan Gray. I would like to first begin with a land acknowledgement. The City of Toronto acknowledged that we are on the traditional lands of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home of many diverse First Nation, Inuit, and Métis people. The city also acknowledged Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the William Treaty, signed by multiple Mississaugas and Chippewa bands. I would also say thank you very much for our co-host for tonight, and that would be Hung Fu Mental Health Association. In addition to that, we also have the South Asian Legal Clinic. I'm going to open up the floor to Adush to be able to just say a few words from the South Asian Legal Clinic. Adush, are you able to unmute? Go ahead.
Yes. Can you guys hear me?
Perfectly.
Okay, awesome. Thank you so much, Megan and Roseanne, for coordinating everything today and for the TPS, of course. So my name is Adish Vaithalingam. I'm a paralegal and community legal clinic here, community legal worker here at the South Asian Legal Clinic of Ontario. So we are a community legal clinic that is mandated through Legal Aid Ontario. We are a specialty clinic that serves low-income South Asians in the Greater Toronto Area and actually throughout Ontario. Our mandate is Ontario-wide. We are located at 45 Shepherd Avenue East, so that's at Yonge and Shepherd. However, we do have satellite clinic services available throughout the GTA. And at our clinic, we can directly serve clients in English, Hindi, Urdu, Punjabi, Sinhala, Bengali, Tamil, and Kannada languages. So a variety of South Asian languages. And we do have a financial eligibility criteria for our services, but it is a little bit higher than Legal Aid Ontario's. And we do also have a discretionary ability when assessing cases and the impact that those cases have on members of low-income South Asian communities. And so just to give you an idea of our services, so we do assist in the following areas of law that includes immigration, income security, when it comes to matters of Ontario Works, ODSP, CPP, OAS, and EI. We support in matters of income security, housing, employment, and human rights matters. Well, we do not provide advice or representation in criminal matters, and we do not fill out forms. So we're a legal clinic. We only intervene when there's a legal issue, and we do provide some basic information on family law. And of course, we do provide referrals. Just a quick rundown of some of the areas where we provide our satellite services. So we have partnered with community agencies like Indus Community Services in Brampton, East Scarborough Storefront in Scarborough, the Indus Community Services in Mississauga, Malton Neighborhood Services, Punjabi Community Health Services. So throughout the GTA with a number of community agencies, we partnered to provide our satellite services. And yeah, so that's just a quick rundown of our services that we provide. And we started with the TPS racial data collection strategy initiative. I think earlier this year, we hosted a community consultation, and we've been participating along the way. So it's been a pleasure. It's been a good learning experience. And thank you so much for having us on board, and thank you for having us co-host today.
Absolutely. Thank you very much for the introduction. I'm going to open the floor up to Bonnie Wong. Hi, Bonnie. How are you doing?
Oh, thank you. Good evening, everybody. Can you hear me well?
Perfectly.
Okay. I just want to give everyone just a bit of an information overview of our Hung Fu Mental Health Association. We have been in operation since 1982, and our agency's mission and vision and values is focusing on improving the lives of the Asian communities and others, and we are championing culturally competent care. So for the services we provide in Hong Kong, mainly we began with all the services with adult services, And it's a full range of, services that is including intake and referral. We have case management services. We have support within housing. We have prevention and promotion programs to raise awareness about mental health and also to reduce stigma and discrimination. And we have, many programs to support people in recovery. So we have established Recovery College, and we have many other professional development programs that is for service providers, especially serving the immigrant and refugee populations. And that's called Journey to Promote Mental Health program. Is over, been running across Ontario, and the training team has been traveling to deliver mental health workshops for settlement workers. So far, we train over 4,000 service providers in the province, both in English and French. And we have target client populations that are from the Chinese and Southeast Asian countries, that including Cantonese Mandarin population, Korean, Vietnamese, Cambodian. And we also have many programs that is health related, and we have community partners and hospital partners. And one very popular health services is our Asian clinic. That is, we have collaborating psychiatrists who speak different languages. We're able to provide diagnosis, assessment, and treatment. And we also have a registered nurse to help out with medication management. We have a sister organization called HF Connecting Health Nurse Practitioner-led Clinic. That's a primary care clinic that staffed by an interprofessional team, including nurse practitioners, collaborating psychiatrists, general practitioners. We have not just registered nurses, dietitian, social worker, health promoter. So that is a team-based care that we offer. We also partner with Toronto community paramedic teams that is set up the community paramedic-led clinic in a few local housing that's run by the Toronto Public Housing. And we also have psychotherapy programs and other, volunteer development programs. We do run a lot of workshops, including mental health first aid programs and other, stress management. So we develop a lot of the resources toolkits, and they've been translated into multiple languages. So welcome to browse our website, and that you will be able to access all these health information and resources. We also have done a lot of work with academics that is including research and community needs studies. So one of them, just like this one, that is to partner with the Toronto Public Health, Toronto Police. And that's important thing is we really would like to bring the community become aware they can seek help how to improve the relationship to build an inclusive and healthy community. Almost every other year, we run diversity and equity in mental health and addiction conference. We have a lot of partners, including CAMH, CMHA, many others, Mount Sinai Hospital, University of Toronto. So we really champion and advocate for equity, diversity, and make them public become more aware of their rights, as well as improving equitable access. So in this community, initiative, we actually help the Toronto Police to translate those questionnaires into several languages, including Chinese, that's in a traditional and simplified version, and Korean and Vietnamese language. So we've been successful, run 4 focus groups with over 50 participants. and has been run in 3 different service locations, that including North York, Scarborough, and downtown Toronto. We think that this is an important dialogue engagement for Hong Folk. We really are supporting community engagement. So we actually have our model of how we engage with the community. That is like to inform them, to involve them, to consult them, to design programs with them, because we champion for a strength-based model as well as peer-positive model. So we definitely view the value of co-design, co-deliver, and co-review programs. So thank you very much for involving Hong Folk, and we are delighted to answer any questions.
Thank you so much to both of you. As part of the report back, you'll hear from the court, I guess, pretty much all of the information that we have correlated. And both the South Asian Legal Clinic as well as Hong Kong Mental Health Association were very instrumental in reaching a population that we needed to hear their voices within that. So before we start, I would like to provide an overview of the conversation this evening. First, we're going to hear from Deputy Chief of Police Peter Ewan, and he's going to provide an overview about the engagement and the efforts to date. Next, we're going to hear from Dr. Mai Fan and Mrs. Neha Dinka from the Equity, Inclusion, and Human Rights team. While we'll be rejoined by Deputy Ewan to share the next steps of race identity-based data collection strategy. There will be an opportunity for people to be able to ask questions. So there are chat features on both the WebEx as well as the YouTube Live. So if you have any questions, feel free to type those in and we will actually be able to answer those. We will ask that any questions that are being posed are specific to the race-based data collection and this meeting that we're having today. If there are any area-specific, like North York-specific questions that you might have for police, specifically within your area, we do have a number of Toronto Police Division on the actual WebEx today, and we can actually direct your questions directly to them. And there is a raise hand feature in WebEx. So if you do have a question, we will start a speakers list and you can actually raise your hand or type the questions in. And I think that's about it. I will start off with going to Deputy Ewan and to start us off with the presentation.
Thank you, Roseanne. Good evening. Thank you for joining us at our third of 4 virtual town hall meetings. I wish we can be in person and engaging, but COVID has brought us to this stage and we will make this work. And before I start, I want to thank our 2 co-hosts, the Hong Kong Mental Health Association and South Asian Legal Clinic. And thank you very much for participating in the initial focus groups. And I heard some key words during your introductions: building trust, transparency, and accountability. These are things that what the race-based data collection strategy is all about. And you're going to hear from my colleagues later on during our presentation speaking to these very topical issues. Before I get started, I want to take a couple minutes to explain why we're here. We're here today because during our last round of town halls on race-based data collection, we heard you. And we heard that in order to get this right, we must do much more to gain your trust and acknowledge our mistakes. Well, we're here to build trust, not to erode it. These conversations on race are long overdue. Are they easy to have? Certainly not. They're very uncomfortable. Anytime I have engaged our own officers or the community speaking about race is a very, very uncomfortable conversation. And that's why perhaps it's taken us so long to get here. We're here. We're here to speak about this. We're here because we want to eliminate systemic racism in policing. We're not the only one looking at how we can collect race-based data. The child welfare system is doing it. The education system is doing it. We're all doing this because we have one common goal, is to recognize systemic racism exists in these institutions. But in order to eliminate, we need to understand it. One of the most powerful takeaway for me from the last round of town halls on this subject was from a community member who said this: police must be present looking at us in the eyes and realizing what we have been through. I'm a racialized person myself. I have experienced racism throughout my lifetime, and I have experienced racism by other members of the Toronto Police Service. Now, am I saying I can relate to the experience of a young Black person who is pulled over for speeding? No, I cannot. Am I saying I can relate to the experience of a South Asian male? No, I cannot. But one thing I can say, we all have our own lived experiences, but we all have in common is that some of us have experienced systemic racism. For some of you, this may be the first time you're joining us for these important discussions, so I want to bring you up to date, a little historic perspective. In 2017, Ontario's Anti-Racism Act was passed with cross-party support to establish a legal framework for eliminating systemic racism and advancing racial equity. Further, in April 2018, the provincial government mandated the collection of race-based data by organizations, as I mentioned before, in the public sector, child welfare, education, and justice sectors. Policing belongs to the justice sectors, and established the anti-racism data standard to provide guidance on the collection and analysis of this data. In response to this standard, the Toronto Police Services Board played an important role. They work with stakeholders to develop and inform a new policy to identify, monitor, and eliminate potential systemic racism through the collection of race-based data. As we move forward, our Equity, Inclusion, and Human Rights Unit is working with all relevant areas of the service to establish training, procedures, implementation plans, and guidance on the recording, storing, analyzing, and reporting of this data. Next slide, please. As you know, for the last few years, the Toronto Police Service has been undertaking a major modernization effort that will create a police service that is consistent, accountable, transparent, inclusive, and community-focused. Race-based data collection is the next logical step in a discussion the Toronto Police Service have been having for years, how to best support our members to ensure that they're delivering equitable, fair, and non-discriminatory police services. We know how important it is to get this right. We must assure our communities that this data will allow the service to understand how our actions impact them and make operational decisions that will minimize over-policing, manage implicit bias, and help address suggestions of racial profiling. We must also be mindful of privacy concerns and work within our oversight framework that is rooted in integrity and professionalism. We will implement measures to ensure that race-based data is only available to specifically designated and trained members. We will consider a retention policy to ensure that we are only keeping race-based data for an appropriate time, and will consider the impact of freedom of information requests. We have also committed to analyzing and reporting race-based data only after all personal identifiers have been removed. Phase 1 of our strategy started on January 1st, 2020. We began collecting race-based data for use of force incidents using the forms that have been prescribed to us by the province and strip searches. The data is being collected using an officer's perception based on prescribed categories from the province. Phase 2 is what we're here to tell you about today, and we'll get into those areas a little bit later. Next slide, please. Community engagement represents an integral part of this strategy. Over the period of October 2019 to February 2020, we engaged in our largest community engagement endeavors ever to raise awareness about the race-based data collection strategy and gather public feedback to inform the Toronto Police Service decisions throughout the implementation process. A multi-pronged approach guided the service community engagement to ensure feedback from a geographic and demographically diversity of voices. It represents the concerted effort of various units across the Toronto Police Service and a range of community organizations serving diverse groups across the city. A series of 69 engagement opportunities led by 30 community organizations brought together over 880 members of diverse communities to voice their opinions about the service's race-based data collection strategy. The map that you're seeing shows the location of community consultations across our city. 4 public town halls took place in neighborhoods representing different areas of the city: Alexandra Park, Black Creek, Regent Park, and Malvern. Approximately 60 people, 15 on average, participated in the town halls. They were also live streamed on Facebook, and with other social media efforts, we were able to reach thousands of people. Next slide, please. Our focus group sessions created a safe space for conversations. As you can see from these demographics, most of the attendees were young people from Black, East, Southeast Asian, and South Asian communities, and many were not born in Canada. It was critical that our focus group partners hosted individuals with lived experiences that could properly inform our strategy. We also made a point of having no police presence at these sessions, so community members could freely express their views and engage in deeper conversation about the race-based data collection strategy. Now I'm going to turn it over to my colleagues for the next several slides. Thank you.
A range of key themes emerged from various engagement sessions the deputy mentioned, and I will walk you through some of these in broad strokes, and we invite you to check the report on our website, or if you are interested in a hard copy, please contact us and you'll get a copy of the report. One of the key themes that emerged through this conversation was around reconciliation and trust. Community members emphasized the need for the service to acknowledge the mistakes and harm caused. They see it as an act of humility that validates their experiences, and it is also an important step to reconciliation with various communities. Participants also emphasized that trust is critical to the success of race and identity-based data collection strategy, and they hope that this strategy will improve the relationships between residents and police. Community members also made it very clear that they expect to stay engaged throughout the entire process of the strategy implementation, and they expect the service to design a process that allows them to be informed, stay engaged, and provide feedback at key stages of the strategy. Next slide, please. Throughout the series of community engagement, people consistently voiced their concern about why this data is collected, how it's protected, and how it will be used. Several participants questioned the need for collecting new data without taking concrete actions, as they felt that there are already several high-profile reports that documented racism in policing. They would like to see instead more concrete actions to address systemic racism. Community members were also concerned about the fact that the service will not use the data in good faith. People worried that the data will be used to further stigmatize certain communities. And they also question whether one strategy would be enough to address the broad issue of systemic racism. But despite skepticism and concerns, many participants regarded the strategy as an opportunity to hold the service accountable for its actions in the community. They see the strategy as an opportunity to support police officers to develop cultural awareness and skills to better interact with diverse groups. And they also hope that the strategy would provide evidence to bring more resources into disadvantaged communities. Next slide, please. Focus groups especially provided the space for more in-depth conversations around ways of collecting data. Participants debating the merits of perception versus self-reported data collection. Many community members regarded the self-identification data on one hand as more accurate compared to perception data, and more respectful as people have the opportunity to identify themselves instead of being labeled by others. But on the other hand, many people were reluctant to share their information, being concerned that they might be treated differently once sharing their information. Participants also provided nuanced feedback on various factors that would influence their decision to share or not sharing their information. The why behind the officer's request for information is critical. People emphasize the need to know why their information is requested and how it is relevant to their specific interaction with police. Participants also reported that they would feel more comfortable to provide their information to a neighborhood community officer rather than to other police officers. The timing of the request is also critical, and as the graph on the bottom right shows, most of participants reported that they would prefer to be asked for the information either at the end or after the interaction. After the interaction being the most preferred option. So this is what we heard from you at high level. And as I mentioned before, please check the report for more details. So check our website. And I will turning back to the deputy now to tell you more about how the service is going to act upon what we heard from you.
Okay, so what have we done with this feedback? When it comes to relationship building, we are committed to developing a dedicated Indigenous engagement strategy in collaboration with our Indigenous groups. Also, we're committed to develop mechanisms that facilitate engagement with young people, those living with disabilities, including mental health and other members of the vulnerable groups. Developing a public awareness campaign to reach out to diverse communities and clearly communicate the scope, relevance, and key undertakings under the strategy. Creating a community advice panel comprised of community members with lived experiences, academics, subject matter experts who work closely with the service to advise data analysis, interpretation of results, and reporting. At this stage, we have over 300 applicants for this panel, and we expect to have the group in place by January 2021. When it comes to the management of the data, we are developing an analytical framework to guide the analysis of race and identity-based data, and will engage internal and external stakeholders to reflect operational and community realities. We're currently procuring an independent third party to conduct and publish an independent data analysis. We're also developing an open data framework to provide public access to de-identified data and analytics for research, policy making, and advocacy. Next slide, please. We had significant feedback when it comes to the training of our officers, including how critical it is for service members to understand the purpose and fundamental concepts of race and identity-based data collection to promote bias-free policing and enhance community trust. The service is delivering a training curriculum that builds on community feedback and will roll out the training across this entire service to enable transformation from within. We have implemented multiple training delivery methods because we know this topic is too important for just online training. We have delivered technical briefings for those members and supervisors who need to understand the legislative requirements in a deep and meaningful way. We have implemented Indigenous experiences, anti-Black racism, and implicit bias training into yearly requirement for all our police officers. Our senior officers have received training on issues of equity and inclusion, as well as the race-based data collection, and we're providing both online and in-person training for our members. As the strategy evolves and we continue to engage our communities, our training program will continue to evolve and grow as well. Now I turn it over to my colleagues again for the next several part PowerPoint slides.
Thank you, Deputy. So one of the key themes we heard from our engagements was how important it was to be clear in how we handle the data and protect people's privacy. People were concerned also about data quality. They want the data to be accurate before we use it in order to give us reliable results that can be trusted. The service looked at our data systems and practices and developed procedures to assess and handle race-based data in a secure and protected way and prevent its misuse. We engage with the Information and Privacy Commission and stakeholders on best practices to ensure that we also address concerns about data quality and retention so that we can analyze long-term trends and manage changes, monitor the changes over time. So this means that data collected and recorded by officers is verified and approved by supervisors. We have secure data management systems to store and protect that data. Data also needs to be compiled and anonymized for use in analysis so that individual identities cannot be discerned from the data. Designated staff with authorized access prepare and further assess the data sets before using it in analysis and are responsible for securely retaining that analysis for 20 years. Next slide, please. So now we'd like to hear more from you. In the next steps of the strategy, as we had been collecting data since Jan 1, 2020 under our first phase, which is use of force and search data, we are preparing to analyze it. But we need to have a framework in place with principles to guide us in how we look at that data and that reflect community and internal member perspectives. We also are seeking your advice tonight about other priority areas to collect and include under the race-based data collection strategy so that we can understand our impacts. Next slide. So in analyzing our data, we are proposing to take a principled approach. Race-based data analysis has to be used to support training, to monitor and evaluate and improve our policies, procedures, and practices. It's not just data collection for its own sake. It has to have a purpose. For trusted results, analysis has to be done in an open, transparent, and fair way. We are creating an analysis framework to guide that approach to looking at the data, and this is where we need your advice. So for example, we've identified 4 principles which together should guide our approach and that reflect our priorities. So centering race and racial disparities is an important principle in order to assess and analyze whether there are systemic racial biases and racial disparities in outcomes. Centering race and racial disparities doesn't mean focusing on race alone. It means also taking an intersectional understanding to our analysis so that the unique experiences of individuals based on a combination of identities can be understood. So race and gender, race and mental health, for example. The second principle we identified is that our analysis should reflect engagement. This means that we include different perspectives and contexts for a fuller and balanced understanding of trends and patterns that may emerge from the data. The third principle is to use sound methods that reflect best practices and innovative and accepted techniques for trusted and robust results. And a fourth important principle we've identified is that analysis should be solution-oriented. That means that we ask the right questions in order to lead to actionable insights that can support positive change. It also means that analysis and interpretation is systems-focused and does not stigmatize communities. So our question to you tonight is, what principles do you think should guide TPS's analysis of data? Are these enough? What other ones should be included in the way we look at our data? I'll give a few minutes for you to enter your comments or questions in the chat boxes or raise your hands if you're using WebEx, and we can activate your mic.
Thank you, Dr. Fan. Again, we would just ask that you can either enter your comments or questions into the chat function for either WebEx or YouTube. We are monitoring both of those channels. Or you can use the raise hand function on WebEx if you would like to ask the question or make your comment directly to any of our panel members. There will be a couple of other questions that Dr. Fan will pose to the group, and then we will also open it up to general questions with the race-based data collection strategy for those who may have questions that are beyond the scope of the topics that we've posed to you for feedback purposes. We have a comment that's come in. Could you elaborate further on how intersectionality is being operationalized and incorporated into this framework, i.e. income, mixed race, gender identity, and are consultations being done to ensure that these are grounded in lived experiences and research?
That's a fantastic question. Thank you so much. So right now, in phase 1, we have certain data collection practices in place in order to allow us to do some intersectional analysis, not the fulsome one, but we are currently exploring other ways to collect sensitive information, such as income and housing status, for example, as just some examples of areas where we would like to start collecting more information so that we can do a robust analysis. But right now, we have certain data like age, gender, and other information. There's limited information about mental health status that we may access in our data in order to do the analysis. So wherever we have it at the moment, we will be certain to include that lens. And in terms of ensuring that lived experiences are reflected in the way we look at the data and also in the way that we interpret the data, we have the community advisory panel that we are currently establishing, Deputy mentioned, and that will comprise of diverse members of Toronto, representing Black, Indigenous, other racialized communities, Muslim communities, as well as youth, in order to help us look at our data and inform the analysis as well as the interpretation and reporting of that data in a way that will reflect community perspectives. We will also plan extensive rounds of community engagements when we have the data and the results to come to you in a public forum such as this, but we may also draw on the model that had worked previously in our first round, where we work with community agencies to facilitate focus groups to look at our data. So there are a number of avenues we are pursuing in order to ensure that that lived experience is reflected in the way we look at our data, and as well as the perspectives of our internal members, so that their perspectives in relation to their jobs, the procedures and policies that they have to follow are incorporated in our understanding of the data as well.
Thank you, Dr. Fan. We have another question. With the Toronto Police Service now using body cameras and surveillance cameras, is identification of persons by any type of camera covered by the policy on race-based data collection?
I can take this question. Certainly, we are rolling out body-worn camera, but we mentioned earlier that the only time we're capturing that data right now, race-based data, is two areas. From perception-based, certainly for, as I mentioned earlier, is for use of force and strip searches. So use of force happens generally in a public area where the body camera will be activated. But if the person is subjected to a strip search, it will be in a private area and there will be no body camera rolling. So, but as we move forward into developing more areas where we collect race-based data, anytime our officers have interaction with a member of the public, that footage of the body-worn camera will corroborate what we are capturing in terms of the race data.
There are no other comments right now. Dr. Fan, if you'd like to go on to the next question.
Sure. Can you advance the slide, please? So here I wanted to get more specific about one of the principles that we're proposing, the reflect engagement principle. Collaborative community-based analysis means that all stakeholders are involved and have a real opportunity to inform the analysis and interpretation of the results. So this speaks to the question that was asked earlier. And we know this is really necessary because reality will always be more complicated than the data can reflect. And I spoke a little bit about the data gaps that exist currently and what we're doing to try to close that gap in the types of data that we collect. And we also know that there are many ways to understand something. That's why we need to engage often and in a meaningful way to understand what is going on more holistically. We will engage with affected communities and individuals with lived experiences, including diverse members of the city and our officers. So to understand specific interactions, for example, we will look their age, race, mental health, physical condition, behaviors at the time of the arrest, for example, or the search. Officer factors where data is available could be included as well, such as rank, years of service, and also contextual factors to help us understand the patterns and trends that emerge, such as neighborhood and divisional characteristics. So our question for you today is, what should we consider in order to understand the results from the public's perspective? Give a few minutes for comments in the chat boxes, questions, or if you want to raise your hands.
So again, we just ask you to type your comments or questions into the chat function. For either WebEx or YouTube, we are monitoring both. You can also use the raised hand function on the WebEx, and we'll call on you if you'd like to ask your question directly. We have a question that's come in. I wonder how the officer's perception will impact the accuracy of data collected. Could you go into details about that?
Absolutely. Thank you for asking that question. It's an important question to understand what is the usefulness of officer perception as in relation to self-ID data. So those are two different types of data. When we're asking about, when we're looking at officer perception and we want to understand systemic racial biases in potential treatment and outcomes of individuals, then officer perception does matter. What we want to know is are there systemic biases occurring in how TPS operationalizes its policies and procedures? How an officer perceives an individual, does it impact their treatment or the outcome of that individual? Does the officer's perception have reflect bias, unconscious biases or implicit biases in that treatment? And so officer perception is a relevant and important measurement in order for us to uncover that. Self-reported identity is also important to understand other aspects of a person's lived experiences. So how an individual may identify themselves would help us to to know if there are systemic barriers in that person's access to programs and services, and also how they may want to be able to identify their needs. So for self-reported identity, it's not just about race, it's also about ethnic origin, it's also about religion, indigenous identity, gender identity. Are there barriers in how they are accessing these services or in how they experience their treatment by Toronto Police? So those are two different, very different measurements of race, let's say. And we will be exploring ways to collect self-reported identity in order to get that more nuanced picture of an individual's experiences so that we can identify and remove systemic barriers.
Thank you, Dr. Pham. The next question says, are there other models or measurement tools that have been used internationally that can help guide success or outcome indicators in this strategy?
Thank you so much. We have done an interjurisdictional scan in terms of how are other police services conducting race data collection and analysis in order to address racial profiling, racial disparities in outcomes, in policing outcomes in other jurisdictions. And by far the biggest method of collecting about race is officer perception for the reasons I just explained. So, you know, most jurisdictions are interested in understanding if racial bias is at play and how much of that is historical, how much of that is systemic, how much of that is individual racial bias that leads to disparities in outcomes for communities. Some jurisdictions also collect self-reported identity. So the UK does do that. And they collect both officer perception and self-reported ID. And so we are looking at their experiences and learning best practices from that jurisdiction in order to inform our approach. And what we found so far is that, you know, particularly in our community engagement sessions that Miha had just shared, some of the results is that the collection of self-ID is not a simple matter. We wanted good, robust, accurate data for self-ID because it's a voluntary piece of information. We have to do in a way that respects individual dignity in the moment of the collection, but also ensure that personal privacy is protected. And so the manner and the context in which we collect that information is very important. And we don't want to be in a situation like the UK has, in which their data in regards to self-reported identity has very low response rate, and it's biased. It's a biased response rate, meaning more racialized individuals choose not to share that information, and so that really affects the analysis and the outcomes. Officer perception is more accurate in the sense that it's has a much higher response rate because officers have to provide that data. And so it's a much more useful metric in order to identify racial disparities and bias. And it's also a much more robust metric because of the requirement that officers provided. However, that also means that we need to have good training for officers to understand what it is that we're asking them to provide, why we're collecting that data, and ensuring that we have mechanisms in place to ensure that officers are being honest and checking off the appropriate category based on their best guess, so to speak, their perception of the individual's race based on their observation.
Thank you. We now have another question, this time from our YouTube chat. How will you make sure you are not presenting data showing correlations as causational patterns? If this distinction isn't maintained, the data will be misleading and do more harm.
Absolutely. And that's an excellent question. And we will be very careful not to make draw causal conclusions from the data. you're quite right. Correlation is not causation, and that's something that we will include in all of our engagements with both community members and internal service members when we're looking at the results to interpret the data. And so community input from subject matter experts, the independent researcher who will also look at the data independently of us and also audit our analysis will support that and make sure that the way we interpreting the data is actually supported by the data.
Thank you. Those are all the questions we've had come in right now. Dr. Fan, if you'd like to move on to our third and final question.
Sure, yes. So the third question that we have for you tonight is in relation to where do we go next? So as Deputy had mentioned earlier, phase one, we started with script searches and use of force reports in order to understand our impacts in those areas. But we want to know what your priorities are in terms of where else should we be collecting and including under the race-based data strategy in order to inform more equitable police services and ensure that we address any disparate outcomes as a result of particular interactions. So what other policing interactions are meaningful to you for us to include in phase two? So our question is, what police interactions do you think we should focus on next and add to our analysis and public reporting? A few moments to think about it. Enter your comments, questions in the chat boxes, or raise your hand in WebEx.
We have a question that's come in. When exactly is the data being collected by the officers when engaging in the different kind of encounters? And when will the self-identification data be collected?
Thank you for that. So in relation to strip searches, the data is will be analyzed, to understand whether there are disparate patterns in who gets searched. The data is actually collected at the point of arrest. So when a person is encounters a police officer and is under arrest, they are taken to the station to be booked, and the officer will create a record then and identify their perception of that person, as well as other relevant information like what were they being arrested for, what are the relevant charges at the time, etc. So the data is part of standard procedures. Deputy, did you want to add anything in relation to the use of force reports?
Use of force, as I mentioned earlier, is a prescribed provincial form. And because of the data collection, the prescribed provincial form has added a extra category on the perception based on the 7 categories prescribed to us by the province for the officers to check the box, if I can use that. And generally, use of force is done after the fact, that after an arrest or an encounter and a incident with the person, then the officer, once use of force is used and reaches the threshold, the officer, he or she are mandated to fill that form, and then so that is collected after.
And what was the second part of the question?
When will the self-identification be collected?
I think we're still in the consultative process right now, and this is the first stage of conversation with the public about the self-identify process that we're undertaking with the Toronto Police Service. And I can assure the public that we'll be coming back over and over, because we know this is a very difficult process, engagement piece. We want to get it right, and we want to get as much feedback from the community to frame, to develop what is the right context, what are the right timings. And you saw earlier one of the slides that we presented from the focus groups. our participants told us that they would rather have it after that we collect it, after the interaction. So at this stage, we're not committed to prior or after, but we are still open for discussions on that one. So that one is stay tuned because we have yet to develop that framework.
Yeah, and I just wanted to add that, another challenge with self-ID that we need to work out and align with the service's overall information technology transformation initiative. So self-ID, as you know, would be a voluntary collection. Members of the public do not have to provide that information, but we want to find ways that will encourage people to provide that information in a safe manner, in a way that protects their privacy and is locked down, meaning that whoever doesn't need to know and doesn't need it for their jobs does not have access to that information. So it's safe and secure. And this is really important for the public trust element of it and also the accountability piece. And so we may need to explore different systems in order to do that, because our current systems may not be adequate to protect that and secure those information separate from other policing data.
Great. We have another comment and question here. Research on systemic racism generally concludes that barriers to equity do not rest with individuals being harmed by the system, but rather the system itself and the actors within. Does the race and identity-based data collection strategy include provision for data collection and analysis of frontline officer or management bias and its potential influence on decision-making, as opposed to looking exclusively at those who interact with police on the customer end?
That's a fantastic question. So our analysis framework would be very careful in order to articulate all the assumptions that are behind the analysis. And one of those assumptions that we want to be very clear about is that the data that's collected by police is police data, not community data. What I mean by that is that while we often talk about crime rates, and I don't know if you can see my air quotes, crime rates it often relies on arrest data or charge data collected by police. However, it's used as a proxy for offending rates in the community, but that's not what it is. So how we understand police data is that police data reflects policing practices. It doesn't reflect the reality out there. We know the majority of crimes go unreported. We know the majority of crimes go undetected. And so it's a misnomer to call them crime rates. It's really police arrest rates or charge rates. And we should talk about it that way. And that means that when we're looking at our data, it reflects how we are policing, not about communities. And so when I say, when I spoke about one of the principles is being solution oriented, and that means that it's systems focused and not community focused, that's what I mean. The data should not be used to stigmatize communities or reflect what is wrong with communities. It should be focused on what we are doing, what is our impact on communities, and how can we mitigate those impacts? How can we support communities better?
Thank you. There's just a comment here that if police are identifying people by indirect means, as an example, Clearview AI, it should be logged as an electronic identification of a person. We will certainly make note of that comment, Deputy Ewan. I don't know if you just want to take a moment to address the service's use of Clearview AI, but we also have another comment coming in as well, so I'll leave that one to you for the moment.
We are not currently using any AI technologies, and I know that the chief has addressed the Clearview issues very clearly earlier, several months ago. So right now we're not collecting data based on artificial intelligence.
So the next question, will collected data be owned by the Toronto Police, or if a third party is conducting the analysis, owned by an external party or combination? And will a data governance policy be publicly available as this strategy is rolled out?
Thank you for that. One of the important principles of the strategy overall is transparency. And so we will make it public in terms of how the data is being governed, as well as being protected. And so you will, if you go to our public-facing website, you will find some information in that regard. There is a governance committee that oversees how this work is done, ensures that decisions are made, and ensures that it reflects our priorities as a service, and also that it reflects the principles that we publicly state. And so, in terms of, the first part of the question.
Will the data be owned by Toronto Police, a third party, or a combination?
Right. So there's two aspects to that. There's the data internally that we will be using to do our analysis. It will be anonymized, meaning that individuals cannot be identified in the data set that's created in order for us to do the analysis, either the public member or the police officer that is involved in an incident, in a record. So individuals cannot be identified. We will also make the data publicly available through open data, open analytics, and in that sense, the data will be owned by everybody. And we will be involving an independent researcher to help us audit our analysis, but also to conduct independent analysis of that de-identified data as well.
Thank you, Dr. Fan. There are no other comments or questions in this moment. So I believe we have another slide.
Yes.
Yes, we do. So I will just let Dr. Fan go over this slide as well.
Okay, so this is just a summary of the questions we brought to you tonight. I know it was a lot of information we shared with you. We had Deputy and I did a lot of talking. And so we'd like you to take these questions away, jot them down, jot down the email address at the bottom there, inclusionData@torontopolice.on.ca. Please have conversations with your friends, your family, your coworkers, your neighbors about this strategy. You can find more information on our website, as I was saying earlier. And we welcome your input in terms of, how should we approach our analysis, what principles are important and critical to you and your community, what other interactions are priorities for you for you to help hold us accountable and understand our impacts and understand how we can improve policing in Toronto.
Thank you, Dr. Fan. I just want to ask Deputy Ewan just to take a moment to speak to the all-command approach that the Toronto Police Service has when it comes not just to the race-based data collection strategy, but to the equity, inclusion, and human rights mandate, if you will. They have a number of projects. And if you could just, again, take a moment to explain to the group what this project and others under the equity and inclusion lens mean to the chief and the rest of the command team.
Certainly. Thank you for that, Megan. You know what? We're living in some special time right now. We're seeing a movement globally in North America and also in Toronto. I've been a police officer for over 30 years, and we're seeing a huge movement. And the movement is seeking change. People are asking for change. And we're not isolated. We're not tone deaf. We hear the public wants change. And Toronto Police Service certainly is very committed to be part of that conversation and to be partnering with communities. And we know, and as you can see, as we demonstrated through this race-based data collection strategy, we want to seek the input of the public. We know we will fail without the participation of our communities. And that's why it's important for us. It's critical for the chief and the command and for the leadership of Toronto Police Service to listen to our communities. And the unit is a new unit because we know it matters. We know it matters when we speak to anti-racism, Black racism. Indigenous and to all racialized communities. We want to be the leading organization, policing agency in this country to speak to those issues openly and collectively together with our community members. So it is utmost important to us that we get it right and to eliminate and to have an inclusive workplace and to have policies that are set that truly serve our communities and also benefits policing and delivering our services both for our members and most importantly for our public.
Thank you, Deputy. Again, if there are other questions or comments, please enter them into the chat function either on WebEx or YouTube. You can also use the raise hand function on WebEx and we can have you ask your question directly. As Dr. Fan mentioned, this is not your only opportunity to submit your feedback to us. Please make note of the email address inclusiondata@torontopolice.on.ca. That's at the bottom of your screen. You are welcome to send us feedback on these questions or on the race-based data collection strategy in general. That email address is monitored by our colleagues at the Equity, Inclusion, and Human Rights Unit. We also have our fourth and final community engagement session for phase 2, if you will, this Thursday, also 6:30. The links for either participating via WebEx or YouTube are available on our website. We have a comment that's come in. How would this strategy differ from or expand upon what information is already collected? And what is the strategy for training officers on implementation?
Thank you. So this strategy differs in a number of ways from the data that has already been collected or previously been collected. One, because the province has mandated race-based data collection across public sectors in relation to certain functions such as, education, child welfare, justice sector, in bail, in adult and youth corrections, and in policing, as well as in public complaints of police. That means in accordance with an anti-racism data standards. So that is the critical piece that differs from the past, and where different organizations were collecting data in their own ways. There wasn't consistency in how the data was collected or managed or used for a clear anti-racism purpose. Under the Anti-Racism Act and data standards, we now have a clear, unified purpose for this data, consistent standards to guide the collection by different organizations. So this will allow us to understand our collective impact. So this is not just about policing, although policing is an important and critical area that I know the public has concerns about, but it's not just policing. It's also about school boards. It's also about inequities and systemic racism in children's aid societies and how we protect vulnerable children. It's also about the entire cycle of the criminal justice system that can amplify vulnerabilities, can really send a vulnerable individual already struggling through the cracks. So we want to understand that collective impact, but also our particular part in it. And so race-based data at this juncture in time differs from the past in that regard. We're better able to connect the dots. We will have more robust data, and also the data will be under an open framework. And that means that, education, children's aid societies, all these organizations mandated will be making that data available so that communities can access that data. Communities can, and organizations servicing communities can look at the data in a holistic way and across different sectors. And hopefully that will lead us to some robust evidence-informed solutions that will work. For a long time, we have not either collected the data or collected data in a very ad hoc, random ways without rigor to it. And that prevents us from really understanding the crux of the problem. Community engagement is baked into how the data is to be collected, managed, and reported on. And that's, again, a requirement under the Anti-Racism Act. Community voices are important, has been silenced for too long, but we need communities at the table, and that's increasingly more and more recognized, that this is not just about data, it's not a technical exercise. This is about building relationships. And at the core of data, especially data in relation to social identities, these gender is a social construct, race is a social construct. These are about us. It's about our relationships with each other. And so we're moving forward on that basis.
And I think the second part of the question deals with training. And certainly, we recognize it's one of our biggest challenges we face as a police service in training our members to understand each context that each and every one of these interactions is very critically important to us. So, as we mentioned earlier in our slides, we're taking a stage approach. First, to have our officer understanding the legislation, the law, the requirement, and then we'll have to have stage it to talk about implicit bias and anti-Black racism, anti-Indigenous, racialized. So it's got to be a stage, and we're looking at seeking academics, seeking best practices around the world. Dr. Fan said other jurisdictions have done race-based data many years before us. So we look to the best practices, and we also are partnering with academics such as Ryerson University to inform us how to best deliver these training to our officers so they understand the context of why we're collecting race-based data, why it's mandated by the government, why the Toronto Police Service is committed to doing that and making sure it's right for the community. So the training is evolving. We cannot say this, we have enough, we have reached a stage where this is the curriculum. The curriculum will be continuously to refine. As we move into stage 2 of self-identifying, there will be other trainings required. So this is a continuous curriculum that we look to. And when we get the community advisory panel, they will be part of the discussion group to inform us on what training can be or should be included with our officers on a moving on basis.
Thank you, Deputy. There's just a follow-up question to the earlier one that Dr. Fan commented on when it comes to the strategy. And the follow-up is this. So this would ideally create more consistency across sectors, meaning coroner, EMS, education, etc.
That's right.
Again, if there are any questions or comments, please feel free to add them in, or you can use the raise your hand function. Again, this won't be your only opportunity to offer us your feedback. You can make note of the email address at the bottom of the slide that's on your screen to send us your feedback after the fact. You can also join us on Thursday for our last community engagement session for this year. Certainly, as both Deputy Yuen and Dr. Fan have mentioned, the service is committed to ongoing community engagement opportunities where we will be coming back to you to have a broader discussion on the various aspects of the race and identity-based data collection strategy as we implement the legislation and its associated standard and regulations. As we draw this evening to a close, I am going to ask our community partners again, Bonnie and Adush, to offer us some closing comments from their organizations. And then I will give the final word to Deputy Yuen. Bonnie, if I could ask you to go first, if you could unmute your microphone, please.
Hi, can you hear me now?
We can, thank you.
Oh, thank you so much. I think this is a very informative session that actually I definitely believe and confident that it will improve the relationship, building the trusting relationship by having the transparency and also articulating the importance of your framework, how you are planning to use the data, how you collect it, and is to get more, buy-in. I think the important approach that you emphasize is about how we can continue to engage with the community. I think it's important not to, forget there are many of, our populations, because they are language, polyficiency. Sometimes we need to bear in mind with how we collect information and make the, community people fully understand in their, language that they prefer. I think this is still probably a gap there, and we don't know how it's going to be addressed. And then other factors is important to know. How do we know the benchmark of your plan in terms of your actions? Because you are talking about solution-oriented approach, so it'll be helpful to know maybe annually what is your target, what is your plan to continue to communicate back to the community so that they can see the benefits of the full participation in your initiative and have a positive outcome. Because sometimes it's, some tangible and some maybe you improving your process or you are doing more training for your staff to improve their capacity, and people would like to see the results. So definitely, I think we love to be able to continue to be engaged and also to see the outcome of your programs as successes. Thank you so much.
Yes, thank you. Just echoing on, can you all hear me?
Yes, we can.
Yes.
Please go ahead.
Yeah, so just echoing some of the points that Bonnie mentioned. Absolutely, it's great that we are at the stage where we're having this discussion. We're able to have a transparent approach and understanding of how Toronto Police Services will be using this information, which is great. Echoing one of Bonnie's points in terms of reaching out to those that may have a language barrier, specifically from the South Asian community, where there's a large presence and which we represent at our clinic. Facilitating that type of collection, if it means translating in specific languages as well, maybe that's something that we can take a look at, especially with organizations like Hong Fook and Salco on board. This is something that through community partners can be facilitated. And echoing some of the points of Deputy Yuen, that we're here to build trust, not to erode it. I think it's important to highlight, since the launch of the strategic data collection, some deaths that we've had as a result of police interaction. These are the type of situations that hopefully, ultimately, this initiative will go towards solving and avoiding. Thank you very much for having us included today, and we're happy to stay on board and to participate moving forward. So thank you very much, Roseanne and Megan, and to the deputy and other participants as well.
Thank you very much. We appreciate those comments from our community partners. And again, just on behalf of the service and on behalf of my co-moderator, Roseanne Bailey, thank you very much for your cooperation and participation this evening. I'll now ask Deputy Yuen to make some closing remarks for us.
Well, thank you very much for everyone that signed on tonight and for some of the wonderful questions. And I know you put Dr. Fan at work tonight because most questions were directed at the expertise of our doctors there, and I can only sit here and support her answers and nod my head. So, but this has been a very spirited and very engaging audience, and I thank you for that. A couple of things that I want to just close the loop on. Bonnie said we need to report back on our results, which we will. Every year, we're mandated by the Toronto Police Services Board to produce a report, a public board report, to speak to the annual collection of race-based data and the results and what we have done and what analysis we have undertaken under the direction of the Community Advisory Panel. So that will be reported back, and I ask each and every agency and the public to keep an eye out on that. The second comment about language capacity, which, yeah, you're absolutely right. We're the most diverse city in the world, and the Toronto Police Service is a reflection of this diverse city. And if it's translating is not enough, then I can assure you from a deputy's position, from the chief, that we have officers that speaks your language. If that's what it takes to come and reach out to each and every one of your communities, we'll do that. We'll have our officers that speaks that language and be the representative of the Toronto Police Service to speak to this important initiative. That we can assure you. So my closing remark is very simple. It's taken us a long time to have this conversation, very long time. And I'm very happy that I am part of this conversation. I'm still a member of the Toronto Police Service that can start this conversation. So this conversation will not end because it will be continuous. And this is a right step. We're here. We got to make this right. You look at this as the movement of our current, generation. If this is the movement of our current generation, it's worth that movement. This is the right conversation, and we are committed. We are committed to be transparent, accountable, and building that trust. And I'm going to ask the community to be part of this, and we will be collaborating with the community to make this race-based data right. And I want to also recognize the effort of the Toronto Police Service. We are the only agency in Ontario that is consulting with our public on how we move the race-based data. So we are setting the benchmark for the rest of the province and hopefully for the rest of the country, because I can assure you, even though this is an Ontario experience, this will be countrywide, that where every police agency will be collecting race-based data moving forward. So I thank you for your participation, and I look forward to another engaged session tomorrow night. No, not tomorrow night, Thursday night. Thank you.
Thank you, Deputy. And again, just to close out this evening, please don't forget to visit our website, tps.on.ca/race-based-data for more information about our strategy, as well as the email address to send us your thoughts. Again, our final community engagement session is this Thursday. Thank you to everyone for participating. If anybody is traveling tonight, please do so safely, and we appreciate your participation. Thank you.